Healthcare for America Now Coalition, and we're here to speak to Senator Snowe and Senator Collins because we need affordable, quality healthcare for everybody in this country.
We know what the solution is: quality, affordable healthcare for everyone in America. We know creating a truly affordable public health insurance plan at the national level will be key to bringing us safely out of this storm.
It means that we need a public health insurance plan at the national level, right? Yeah. Okay. And we know that we need real leadership and bold action to guide us out of this storm. Again, that's why we're here in front of Senator Snow's office. What do we want? Healthcare. When do we need it? Now. What do we want? Healthcare. When do we need it? Now. What do we want? Healthcare. When do we need it? Now. What do we want? Healthcare. When do we need it? Now.
Hi, I am Judith, and thank you for listening to us.
My name is George Grotto. I was born in this great city 61 years ago, and I'm a retired United States immigration officer. And I'm here because I support healthcare reform, and I'm here because my wife Sonia would have wanted me to be here.
My wife and I, for over 20 years, owned and operated a retail business a small retail business in Farmington.
Well, my story is only one of many. In 2006, I was diagnosed with a cancerous brain tumor.
In my case, I'm 74 years old. All right? I would like to retire, but because of the health insurance, I can't retire.
That's what communities have fundraisers so people can have medical procedures. It shouldn't be necessary in the United States of America because the message is if you raise enough or if you have enough money, you can live. If you don't, well, maybe you'll raise enough for your funeral.
If it's not changed and it goes any other way, with my wife's pre-existing ailments, what firm is going to pick her up? What insurance company is going to pick her up? Nothing. They're going to leave us in a position where I am going to have to change my way of living and then decide whether my wife can have a pill or a sandwich.
These can more than easily add up to major expenses for many of us. My story is only one of so many. Not only is my family faced with the uncertainty of cancer, but we are also faced with the financial uncertainty as well, which will eventually lead to bankruptcy, losing our house, and not being able to afford our daughter's college, she's right here, tuition expenses. And as we know, these things have happened to so many others already.
I got a job and it had health insurance, and I made a point to pick the dental care and say, yes, take money out of my paycheck, I want dental insurance. So I paid every month for dental insurance, and I went as soon as I could to the dentist. And they looked at my two front teeth. They said, well, now it's going to be $1,000 for each tooth. And I had two front teeth. That's more, $1,000 is more than my monthly income at the time. So I got to an emergency, and I had to go and get them pulled out.
And my experience as a family doctor is that I see disease much later and at a much worse stage when patients don't have insurance. So a woman who notices a breast lump that's this big doesn't come to the doctor till it's this big because she doesn't have insurance. A person who knows they're diabetic waits until it's wildly out of control before they come in, and so they get sicker as a result. And I think it's really, and then of course they do end up on Maine care when they're sick enough to lose their job, so we still pay for them. But I just think it would be cheaper and more humane to take care of people early on.
Mm-hmm. If these other countries are able to do it, why can't we?
And I guess that's all I have to say.
Well, I can totally relate because I just came off of breast cancer myself, having been diagnosed a year ago. And I was a little surprised myself to see the magnitude of the costs that I incurred. Not to mention, I was also quite surprised at how much I had to take out of my pocket. And I thought I had pretty good health insurance. It is a huge national issue, but I want you to know that the senator is very well aware of the fact that there needs to be some changes. She recently held health forums so that she could gather information and decide exactly what's going to be the best way to approach accessibility and affordability. And I think you'll find that there'll be a lot of commonality as to what she wants and what you want. So keep up your vigilance. It's very important. This is a huge issue that we all have to pay attention to. And I do thank you for coming by. Next time, call me. I'll come down if there's not many of you, so we don't cause any hooplas. But thank you all very much. And again, please stay committed. This is a very important issue.
Well, I appreciate you coming here and
you.
sharing your story, and I will make sure to pass it along to Senator Collins.
Thank you.